Let's go over a few basic guidelines to follow during the surgery. Guideline number 1. All items to be used in the procedure must be sterile. We must take special care to ensure that we do not contaminate the sterile field with the additional inclusion of non-sterile items. Remember that off-the-shelf sterile items such as implants, sutures, scalpel blades, and the implant pack itself are sterile only within their inner wrappers. Remember to check expiration dates where applicable. Guideline number 2. The surgical team must be gowned and gloved. Hand movement must be made within the sterile zone. Once properly gowned, the zone considered sterile for the surgical procedure is defined as the front gown area from mid-chest to waist level. The arms and sleeves are considered sterile from the gloved fingertips to 6 inches above the elbow. Be sure to keep your hands and arms within the sterile zone to avoid contamination. Guideline number 3. Movement within the operating field must be very limited to avoid contaminating the sterile field. Surgical team members should face the sterile field. If a sterile person must pass a non-sterile person, they should do so back to back. Guideline number 4. Sterile objects must not be touched with non-sterile objects. This is important when adding items or pouring liquids into the sterile field. When pouring a liquid such as sterile saline into a cup on the operating tray, the sterile assistant moves the cup to the edge of the tray. The circulator then pours the liquid into the cup, taking care not to touch the cup or anything on the tray. Instruments are also introduced into the sterile field without contaminating it.